we're glad to present to you the Vanderbilt Neurology Residency. Here you'll find a broad range of experiential learning with mentors across the neurological subspecialties.
Our program consists of 28 residents spread over 4 years of training.
The training here is filled with supportive teaching from faculty and co-residents. Trainees always have real-time support for clinical decision-making, ensuring quality of care.
Each training year includes elective opportunities, which can be anything you want to dive deeper into at all.
Nashville is located in the heart of Middle Tennessee and has a population base that comes from over 7 states. This allows us to see a wide variety of pathology and work with patients from all walks of life.
I am an NIH-funded scientist. I have a laboratory. I also am a general neurologist, so I see patients in the clinic and in the inpatient setting. I administer the department, and I'm an educator. One of the things about education that I think is really important is spending a lot of time with residents and understanding who they are as individuals and how they're developing as neurologists. So I spend about 3 hours per week with residents. I have morning report on Monday and Thursdays, and then I do chairman's rounds on Tuesday. The time that I spend with residents is really critical for understanding you as an individual and determining your strengths and areas that we can focus on in order to make sure that you're independent and ready to go as a neurologist.
Our highest priority is to train outstanding clinical neurologists. We have incredibly committed experts creating this framework in outpatient and inpatient experiences. Every resident has an advisor and career mentor to help them think through month-to-month learning as well as long-term career goals.
We're part of the team from the start of our intern year. In our neurology rotations, we get the chance to meet some people in the department and also start to think like a neurologist. I'm excited to explore my passions in critical care and stroke neurology.
My highest priority was to be in an institution where I have a close relationship with my teachers to allow for a natural learning experience. The inpatient and clinic attendings have provided me a safe and graded autonomy that has allowed me to grow into a strong clinical neurologist. These experiences have led me to continue here as the upcoming Movement Disorders Fellow. From my interview day until now, Vanderbilt has hit the mark.
Early in residency, we become proficient at running our own stroke codes and seeing neurologic emergencies so that we can handle anything that comes in overnight. At the start of our second year, we have Buddy Call, which has an upper-level resident paired with us so that we can get our feet wet without feeling too overwhelmed. One of the highlights of second year has been starting my own neurology continuity clinic in which I see a variety of different pathologies and allows me to build relationships with patients and attendings.
My career interests are a bit unique. I'm going into sports neurology. The elective time has helped me launch into this career, and the faculty have been so helpful and supportive in our career decisions.
I've received great sponsorship and guidance with my research interests, which led to elective time with our interventional pain neurologist, Dr. Kasayan. This led to a poster presentation at the American Academy of Neurology.
We get hands-on training in LPs, EMGs, EEGs, and toxin injections.
Thanks for taking the time to check us out. We hope you find our program inviting and comprehensive. We hope you'll consider making Music City your home for your training in neurology.